What makes life worth living in the face of death? Let me read this. Please listen. I flipped through the CT scan images, and the diagnosis was obvious. The lungs were matted with innumerable tumors, the spine deformed, and a full lobe of liver obliterated. Cancer is widely disseminated. I was a neurosurgical resident entering my final year of training. I've seen scores of such scans in the last 6 years. But this scan was different. It was my own. I was not in the radiology suite wearing my scrubs and white coat. I was dressed in a patient's gown with my wife, Lucy, an internist at my side. Lucy asked as if reading from a script, "Do you think is there any possibility that it is something else?" "No," I answered calmly. We held each other tightly, like young lovers. This is from the prologue of the book When Breath Becomes Air, What Makes Life Worth Living in the Face of Death by late Dr. Paul Kalanidhi. He was a neurosurgeon and writer. He held degrees in English literature, human biology and history, and philosophy of science and medicine from Stanford and Cambridge universities before graduating from Yale School of Medicine. But at the age of 36, on the verge of completing a decade's training as a neurosurgeon, Paul was diagnosed with inoperable lung cancer. One day he was a doctor treating the dying, the next he was a patient struggling to live. This simple, heartbreaking and lyrical book reminds us of the shortness of life and is a profound reflection on the meaning and purpose of life. If you work in healthcare or not, it's a must-read book. Thanks dear friend Ram for recommending this unforgettable memoir a few years ago, and thank you for watching.